Hi, I'm Dr. Silva, and today I'm going to tell you about the medication Rybelsus. Rybelsus is semaglutide, which is Ozempic and Wegovy and medications that have been in the media lately that are pretty famous these days because they lead to a lot of weight loss. They're diabetic medications for type 2 diabetes, but they have been leading to a lot of weight loss, and so they're kind of in the pop culture. They're having a pop culture moment right now. But Rybelsus is a little bit less known because it is the tablet form of semaglutide. So the others, Wegovy and Ozempic, are injection only. They're subcutaneous injections. So those are famous, but very few people have heard of Rybelsus, and I just want to talk about it briefly because this is a medication that semaglutide is FDA approved for type 2 diabetes. It improves insulin sensitivity and affects a lot of parameters that helps a person with type 2 diabetes, which is often, and I would say usually, associated with obesity, to help regulate their eating behavior. And so it delays gastric emptying time, and it has effects on satiety hormones, where there's an actual feedback mechanism and they feel full faster, both physically as well as chemically. And so it really improves a person's metabolism. And it often leads to weight loss. It's actually recently been approved by the FDA. Ozempic has been approved for the treatment of obesity with one other comorbid condition, such as hypertension or hyperlipidemia. So you don't have to have diabetes to actually get insurance to pay for it. But Rybelsus, I was first made aware of Rybelsus when my primary care physician recommended samples of it. So you can actually sample semaglutide, which can be important because if you're receiving the medication off-label, if you don't have diabetes, or if you don't have a BMI, a body mass index of over 30, so you're not technically obese, or you're obese but you don't have at least one other comorbid condition, which would be uncommon, but if that were the case, but you still needed help, or perhaps you have binge eating disorder or bulimia, those conditions are off-label. But as a psychiatrist, I can tell you that this medication is absolutely indicated for those conditions. It doesn't have the FDA approval, but I can tell you from personal experience that it is a good medication. I'd have another video on that, as a matter of fact, if you're interested in watching that. But you might be somebody who needs this medication or could really benefit from it, but even though you have medical insurance, the insurance won't pay because there's no FDA indication, and it's prohibitively expensive. Thousands of dollars a year. It's over $1,000 a month. And so very few people could afford it out of pocket, even if they could find a prescriber willing to write for it. So I was just talking to my PCP, complaining about my food addiction, about how much I struggle with it. Everything from binge eating to obsessing about food to unhealthy compensatory behaviors. And these have waxed and waned over the years, certainly. And I was just venting when he suggested Rybelsus samples as a way of trying the medication and saving some money. And so I was surprised. I didn't even know it came in pill form, and I had a very good experience with it, lost 30 pounds, and more than that, really gained control over this addiction. And in a way that there is no other medication for addiction out there, and this is including Suboxone and methadone and any of the medications that we've tried for alcoholism, even, I would say, probably better than the bupropion that is used to treat nicotine addiction. There is no other medicine out there that I think works so completely to, over a period of months, to reverse the chemical aberration that is genetic that leads to a food addiction and to an eating disorder, even if that eating disorder is simply obesity. Obesity leading to type 2 diabetes, that's an eating disorder in my book. It may not be in the DSM, but it's essentially binge eating disorder. So you can ask your primary care doctor if they have samples in the office. You can explain if you don't have insurance or you don't have an FDA approved indication, you might be able to access it without having to go to Mexico and buying it over the counter over there. It's still hundreds of dollars, but you could get it here more conveniently, legally, under the auspices of your own primary care physician by asking for samples. The pills are very unstable, so they have to be kept in their special sample bottle, which is airtight, and it's special. It's got like a built-in cork. It's airtight, and it also protects it from any kind of light. And you have to take the medication first thing in the morning on an empty stomach, and you can't eat for at least 30 minutes afterwards. This is because the absorption is so poor, only about 3% of it actually gets absorbed. And if there's any kind of food in your stomach or anything else to interfere, then the chances of you getting even the 3% that you need to get with these pills is going to be pretty low. So they taste awful. They practically start to dissolve on your tongue the minute you put them on your tongue, and they taste awful. So you know, as quick as you can, and with no more than 6 ounces of water. I mean, there's all these rules so that you can get it. There's a reason why subcutaneous injection is what's the norm. But these pills are available. They come in 3, 7, and 14 milligram tablets. The 3 milligram tablet would be the starting tablet, and you would take that for about a month before graduating to the 7 milligram tablet and on up. And they don't sample the 7 milligram tablet. So you would just get started with the 3s. You could, if your physician were willing to give you another month or to keep you going for a few months, you could easily take 2 of the 3s. That's 6 milligrams, close enough to 7, especially when you consider you're only getting about 3% of it under the best of conditions. And the main side effects are nausea, and more nausea. And that's not to say that the nausea is severe. It's just to say that is the side effect that you're going to get if you take a dose that's too high, or if you absorb it too quickly. So there's no really way to impact the absorption, because you got to take it on an empty stomach with just a little bit of water. So you're going to absorb what you're going to absorb. But start with 3 milligrams. Don't increase it for at least a month. And then if you are going to go to, let's say, 6 milligrams, you take 2 3s instead of a 7 because you're still on samples, then you can divide that dosage up by just a few hours, and that will greatly reduce nausea on the higher dose, because you're not getting all 6 milligrams all at one time. You're getting it. Of course, that it's just terribly inconvenient because you can't eat anything. You have to be on an empty stomach. So what I would recommend in that situation, if you're having a lot of trouble with nausea, is to take the 3 milligram dose in the morning and then wait a couple of hours, maybe have some coffee. You can have your coffee and then wait a couple of hours. You don't have to wait all day, and then take the second dose 1 or 2 hours later, especially for those individuals who don't really have breakfast. There are a lot of people who don't even eat until lunchtime anyway, and so that might not be too inconvenient. Or get the 7 milligram tablets. But you can also use antiemetics. There's nothing wrong with taking a little Zofran if you're very, very sensitive to the nausea that comes from this medication. And then there may be times where you take the medication, you don't feel nauseated right after taking it, but then just kind of throughout the day, little tinges. You should not be throwing up. If you are so nauseated that you're actually vomiting, stop taking the medicine. The dose is too high, or you're too sensitive to it. Talk to your doctor. It's not for you, maybe. And maybe there are other things. But you can take a little bit of Zofran or Phenergan or another antiemetic, and that can be very useful. It's not abnormal, is what I'm saying, is that it's not a bad sign necessarily if you have little tinges of nausea just here and there throughout the day when you first start taking the medication until you get used to it. And that may be related to your blood sugar level. So you might want to make sure that you are not hypoglycemic when you experience these little bouts of nausea and or headache. Beyond that, I think it's pretty well tolerated if you're careful with it, and it really is effective at helping a person, diabetics and obese patients and those with eating disorders alike. It really helps them control their eating and then also hopefully to make healthier choices, right? Because once you're not obsessing about food, and because even patients with diabetes, type 2 diabetes, those patients, they have, to some extent, a food addiction. And I think we all kind of struggle a little bit, or most of us struggle with food. It's evolutionary. You know, We didn't evolve to have all this food around us. And then there's so much junk and there's so much fast food, calorie-dense food around us that a lot of people, most people probably, I would say, struggle with their weight. I mean, unless you're just one of those people that doesn't have much of an appetite, they're in the minority, or you're a bodybuilder or a marathon athlete. Even people that go to the gym all the time, even the people that work out on a regular basis, still have to watch what they eat, because one piece of pie is going to knock out 2 hours at the gym. You can't really lose weight by exercising. You'll never catch up with your mouth if you are a foodie, if you are somebody who really enjoys eating and could just eat and eat and eat. And again, we are evolutionarily programmed to eat more than what we need, because in Paleolithic times, there might not be food for a few days. And so your body is made to store the extra calories. When you have such an abundance of calories that every day you're eating hundreds or 1,000 or more calories a day that you don't need, that's when you pack on the weight. That's when your body starts to say, we don't need all of this sugar and all of these carbs. And you start to develop insulin resistance and obesity and type 2 diabetes, and then all the things that go with it: hypertension, hyperlipidemia, dyslipidemia, and then the clinical sequelae, the cardiovascular problems, and the heart attacks and strokes and the dementia and all the terrible things that happen later in life, because big food, like big pharma and big tobacco, and big alcohol, they're trying to sell us, and they try to make food as addictive as possible. As they check out the added sugar next time you're looking at anything that comes in a box or a bag. Check out how much added sugar and how much added salt is in there. Trans fats, thankfully, they're starting to ban, but it's the people that are trying to sell you food, they want it to be addictive. You can't eat just one. They don't care about your health. And so most of us struggle, and some of us really struggle. And semaglutide is a really good medication, and Rybelsus is one way that you might be able to access it. Yeah, so ask your doctor about samples if you don't have insurance or you can't afford it. You also have to find a doctor who's willing to prescribe it off-label if you don't have a body mass index of over 30 or type 2 diabetes. And, doctors can be shy about doing that. You might find a psychiatrist and explain your predicament.